The clock continues ticking toward a midnight deadline that could affect the health care of a lot of mid-staters. Seth Kaplan live in the ABC 27 newsroom with the details. Good afternoon to you, Seth.
Good afternoon, James. We are talking about the biggest insurance company in all of America and one of the biggest healthcare systems in the mid-state, more specifically Minneapolis-based UnitedHealthcare and WellSpan Health. They have been negotiating for the better part of a year on a new contract covering how much United pays WellSpan for health services. The old contract expires tonight at midnight and still no deal. That means WellSpan hospitals and doctors would be out of network for UnitedHealthcare members starting tomorrow. UnitedHealthcare says WellSpan issued a notice to end the current contract and is demanding significant price hikes. Well, WellSpan says that's not true. It says its costs continue to align with those of healthcare facilities in the market. WellSpan says its costs of providing care have risen 18% just because of overall inflation, and it wants to split the difference with United. James, an expert told us earlier this month what you could see is an extension of the current contract, some kind of a short-term extension, not so different from when you see these standoffs between broadcasters and cable companies, right? Something's opted and they say, well, we're going to keep this going for a little while. But you do have to keep in mind that the incentives here are different for each company because WellSpan is the one trying to get those higher rates from United to cover what it says are those higher costs, whereas United might not be in as much of a rush to come to a new deal because it likes the current lower costs.
So again, that deadline, Seth, is midnight, and it doesn't seem like anything is going to happen before then.
Well, sometimes negotiations do come down. You know, that pressure can cause deals to happen, right? We see it sometimes with labor negotiations, right? Where you think there's going to be a strike and then there's last minute. So, you know, we are not inside that room. We don't truly know how close they are. No external sign right now of anything changing, but all kinds of pressure on both companies because, you know, in the end, it's people caught in the middle, people who are both members of UnitedHealthcare and patients of WellSpan, who we've been hearing from in our newsroom, are saying, what do I do tomorrow? And as of now, the answer is those doctors and hospitals would be out of network. So lots of incentives for both of these sides to come to a deal.
Well, then I know that you will stay on this and see if they do come up with a deal tonight. All right, Seth Kaplan, live in the ABC 27 newsroom. Thank you so much for that.